Welcome to our community awareness event. Thank you for being here. My name is Abby Edgecombe. I'm with School Community Intervention and Prevention. We go by SCIP for short. We work with schools across Nebraska to help support student mental and behavioral health. We are grateful for this particular community awareness event to get to partner with Bryan Health and the Lancaster County Health Department to have this really important discussion on youth vaping. This continues to be one of the bigger substance use issues and concerns that we see across the board with our young people, and so we have Dr. Doug Fiedler, who is with Nebraska Pulmonary Specialties, who will be speaking, and then once he wraps up, we will bring up Sadie Jensen with the Lancaster County Health Department, who will do some speaking on some quit resources and addiction in general, and some other key facts about vaping and some of the trends that we're seeing with youth. So with that, I'm going to let Dr. Fiedler take it away.
Hi, my name is Dr. Doug Fiedler. I'm a pulmonary and critical care and sleep specialist here in town. Well, anyway, thanks for having me tonight. I will try to keep it hopefully fun, entertaining, and short. So, we're going to talk about a little bit teen vaping, and really it's just vaping, and because teens are really, I mean, for the most part, they're little adults, and so the effects on their bodies, on adults' bodies, which is I see, I'm not a pediatrician, could be the same as for teens. So. Just some overview stuff. What is vaping? I think most of you know this. Vaping means the use of electronic cigarettes, or what we call e-cigarettes. Basically, it's a device, and we'll show, and you probably see this more in your jobs than I do, but little devices that have a small battery, heats up a vapor, turns into an aerosol, and the kids inhale it into their lungs, and all kinds of bad things can happen from that. So. Similar to cigarettes, the exchange occurs between the vaping liquid and the chemicals in the lungs, gets into the bloodstream, generates the high that people are looking for, and so that's the point. There are lots of different types. Some can be the same, look a pen. Some can look like a flash drive on a computer, as you probably know. Some are disposable. Some are replaceable. They're called e-liquid or e-juice pods, and you've probably seen all these smoke shops pop up all over the place in town. These are some of the vaping devices that we see. These are some of the disposables over here. They're one use and throw away. These are some of the cartridge and tank systems where you can buy a replaceable battery. You can buy a replaceable e-juice for it with different flavors, and we'll talk a little bit about that. And then those are some of the chargers for them. This is basically how it works. If you want to have one that looks like a cigarette, you can have an LED light out here. Here's the battery. Here's the atomizer that will sort of vaporize the air that's brought in. Here's where you put your flavored cartridge in, and then you inhale it into the mouth. And it can contain nicotine, and obviously you can get them with other things like THC and things like that. I'm going to focus mostly on nicotine here tonight. This is one of the more common ones called the ELF bar, and that's what this is. This is a photo of it taken apart with the battery and the cartridge and everything like that. So that's one of the more common ones that can be seen. And again, you guys probably know this more than me. So why does vaping matter? So the CDC conducts a study called the National Youth Tobacco Survey every year, starting in 2011. And this is the data from 2011-2002. And big picture, we don't need to get into the weeds with all of these little lines here, but the big picture, as you can see, from 2011 up to 2017, things were fairly stable, and then things really got popular with tobacco use and vape use with kids. This is the middle school graph that we're looking at. One thing I would point out here is this is 2019 up here, and it took a sharp drop. Anyone want to guess why that is? COVID. So the kids weren't hanging out together, they weren't vaping together, they weren't smoking together, and so it did go down. But as with things like travel, there was a rebound. Look what happened in 2022. So the black line is basically the use of any tobacco product, 13.1% by middle school kids in 2022. The red line here is the use of e-cigarettes in 2022 for middle school kids. And so you can see those are kind of on the rise here. This is the same graph of high school kids. This is from 2011 through 2022. You can see things were fairly stable. They kind of peaked right before the pandemic. Again, came down after the pandemic because the kids were not gathering together. And then once they gather together, just like travel, revenge travel or revenge vaping, I don't know what you call it, but went back up again. And so 33.9% of high school students in 2022 have tried tobacco products. And as you can see, the largest, which is here in the red, of any of those tobacco products is the vaping. And so that's kind of what the kids do these days, is they vape. I just put one slide up because Sadie told me that the new data was out, and I had not seen that yet. But this is the National Youth Tobacco Survey from 2023. So this is new data, the newest we have, I think. Two things I think I'd point out on here is tobacco use. So any tobacco use decreased among high school students between 2022 and 2023. And I don't know that the authors, maybe Sadie knows more about this, but I don't know that the authors know exactly why that's happened. But perhaps more concerning is when you look at middle school kids, who are going to obviously be the high school kids, tobacco use increased from 4.5% to 6.6% from 2022 to 2023. So that keeps going up. And so that's just the newest data, and obviously there's that reference down there. If you want to read the whole article, you certainly can. I was just going to kind of touch on some of the topics. So what are the problems for vaping with young people? And these are in no particular order, but in my opinion, the biggest problem is the risk of nicotine dependence. Because you vape now, you may smoke later, because it's cool. They like to see the smoke come out of their mouth. They like to, their friends are doing it and whatever. So I think nicotine dependence is one of the highest risks. Nicotine poisoning, some of the amount of nicotine can vary from device to device. We don't regulate it as well here in the UK, and in Europe they kind of regulate how much they can put in those things, but they're not regulated well here in the United States. Nicotine poisoning, not often fatal, but nausea, headache, vomiting, sickness, leading to missing school, missing classes, not doing homework, that sort of thing. So those are the problems, some of the problems. Long-term effects, cancer, I'll talk a little bit about this later. This is important for adults, more so. Bottom line is I don't think we know about cancer yet, and I'll explain a little bit more of that later. Fire risk, lithium batteries, as we all know, we've heard the stories about the batteries and the airplanes and Boeing and the lithium batteries that start on fire. Same thing can happen with a vape pen because it has a lithium battery in it. Future addiction is a concern. More serious drugs, cocaine, meth, and the term gateway drug has been brought up before, and that's certainly an issue with vaping and can happen. Vaping increases the risk of switching to regular cigarettes. Brain development for kids, so the prefrontal cortex has some personality and learning areas, is the last part to develop in kids, and having two teenagers of my own, I can tell you that their prefrontal cortex needs to be developed a little bit more before they start making some of the dumb decisions that they are. Vaping can impair cognitive function, can impair attention, and obviously school difficulties, behavioral difficulties, things like that. Marketing is a huge thing, and I think you guys all know that. Pretty colors, beautiful people, neat flavors, doing all these fun things. Here's an ad that you can see. Look at that. Look at those two beautiful people having so much fun. They're going to go get their disposable Juul stick here, go to this party in New York City, and it's just going to be a great time. And so it's a problem. And some of this has been cracked down on, but I mean, it's still out there. Okay, is vaping safer than cigarettes? So vaping is a relatively new thing. I think the bottom line is that we don't know. Okay, we don't know. We know some things about what vaping causes and the health problems that vaping can cause, but I don't think we know yet all of the problems. Back in the 40s and 50s, they thought cigarettes were healthy. Doctors advertised the Marlboros. 9 out of 10 doctors smoke Marlboros, So I don't think they knew about the health risks of smoking back then, and we don't know that about vaping right now. Most e-cigarettes and vaping liquids contain nicotine, and as you know, that's the ingredient in regular cigarettes that makes them addictive. You can only vape occasionally and still continue to crave it, and so that's obviously a problem. People who vape do have similar levels of nicotine in their body to people who smoke, which can cause, we'll go over some of those health concerns here. So we talked about nicotine in cigarettes can be quite different, leading to nicotine overdose or nicotine sickness. It can lead to addiction. They can make a person more likely to start smoking regular cigarettes. And then smoking tobacco, as we know, if they switch to that, leads to increased risk of serious health problems, heart disease, stroke, diabetes, lung disease, kidney failure, infection, cancer. So I'm going to talk about a little section here on what problems can vaping cause. This is kind of an overview here about nicotine addiction, just addiction in general. So I have one graphic. Nicotine is a CNS, central nervous system, stimulant. It attaches to what are called nicotinic receptors in the brain. Those are these things right here. Okay? And it enhances the release of epinephrine, norepinephrine, dopamine, vasopressin. What do those things do? All of those things make us happy. All of them. That's why all the antidepressants that are so common prohibit the reuptake of those, because those chemicals make us happy, and that's what happens when the nicotinic receptors are triggered. So here's your resting state. This is what we call a nicotinic receptor. It's closed, nothing's happening. Boom, it's open. Here's your nicotine, the yellow. Nicotine attaches to it, the channel opens, epinephrine, norepinephrine, dopamine, vasopressin starts rushing through. Feels great, okay? Well, what happens is these channels get desensitized. So even though they're being attached to by the nicotine, they still close anyway because they're desensitized. They can only open for so long. So what happens is you're like, well, that first puff felt great, second puff felt great, third puff didn't feel great, so I need a fourth puff. And the fourth puff didn't feel great, the fifth puff doesn't. So it's just a vicious cycle. And so that's a little bit of the background of why nicotine can be so addictive, because eventually these get saturated and you can't get any more fun from it. So, okay, what are the cardiovascular effects, meaning heart vessels, of nicotine? Increased work of the heart, your heart rate gets fast, your body doesn't like that, your blood pressure goes up by 5 or 10 millimeters of mercury, so 120 over 80, you'll be then 130 over 90. The arteries around the heart narrow. The arteries leading to the brain narrow. It increases your propensity to clot your blood, lead to strokes, clots in the lungs, clots in the legs. It induces a general inflammatory state, which assists with this clotting. It affects your cholesterol metabolism. It increases your bad cholesterol. It lowers your good cholesterol. And so the bottom line to all those things are it really does increase over the long term. It increases your chances of heart attacks or strokes. What other problems can vaping cause? Bronchitis. These are lungs. These are the bronchi, we call them. They're air tubes leading to the lungs. This one on the top here is a normal bronchus, for singular. It's open to the lungs. The bottom picture is one clogged, speaking of mucus, one clogged with mucus. I did not vape before I came over, I promise. And so this is an overview of bronchitis. It's basically irritation of the bronchi. The symptoms are shortness of breath, cough, wheezing, increased mucus production, leading to the issues. Some other problems. These e-liquids contain all these things that you just wouldn't want in your lungs, okay? Vitamin E, formaldehyde. Can you imagine inhaling formaldehyde into your lungs? Acrolein, it's a weed killer. These are in the e-vape cartridges or the e-liquid cartridges. Diacetyl, I'm going to talk about this in a little bit. That's a food additive used to enhance the vapor flavor, and it can cause what's called popcorn lung. Popcorn lung, here we get into some lung pictures that I was told you guys want to see. So, being a pulmonologist, the nice thing about that, it's kind of easy because all of our lung diseases are named after occupations because everybody breathes in things. We have farmer's lung, we have bird fancier's lung, we have coal worker's lung, so it's really pretty easy. You just ask someone what they do and you can make a diagnosis. Popcorn lung is a name for what's called bronchiolitis obliterans. It's kind of a rare condition, but affects the lungs of small airways. It was discovered because there were a number of people working in popcorn factories coming down with this condition. And so that's how we named it. Farmer's lung got named the same way because of that. So they started getting sick, and then these cases come in one after another, and you start to learn why they're getting it. The culprit was diacetyl, right here, which is a food additive like we talked about to simulate butter flavor in microwave popcorn. So don't be inhaling your popcorn bags when you. So that's how that got named. Symptoms of that are coughing, wheezing, chest pain, shortness of breath. You'll see that these are all very nonspecific. These are symptoms of almost every lung condition I see. So we got to dig a little bit deeper. Now, I'm going to show you some pictures. This, anyone want to guess what this is? Lung. It's a lung. Good job. You probably have no idea what you're looking at. I remember when my first day of fellowship, they showed me this picture, picture of these, and I got to look at these lung scans, and I was like, oh my gosh, how am I ever going to learn that? But this is a normal lung. The middle there's the heart. These tree branch things are vessels, so all that is normal. The lungs are black, so air is supposed to be black in lungs, so these are normal lungs, okay? This is a picture of popcorn lung, okay? So you can see the difference. There's normal. So the white is bad. All these changes here, these airway, these we call tree and bud, those are infection. This area is what we would call ground glass here, like your shower door. So we call it ground glass, infiltrate in the lung. This is what a lung looks like when it has popcorn lung. Another picture here, and this kind of compares. This area over here is a normal looking lung, and this area is the damaged lung from inhaling the diacetyl that's in the vape pods. Treatment for popcorn lung is steroids. So these people can generally get better if you're able to diagnose it. The problem is most lung diseases, quite frankly, look like this. So you really got to take a good history, and you got to find out what they were taking and that sort of thing. So what other problems can vaping cause? Lung damage, vaping-related lipoid pneumonia. Lipoid means fat, okay? There are fats in these vaping pods that the kids are smoking these days. So it develops when these fatty acids enter the lungs. It's basically like just what I said, inhaling oily substances, which sparks this inflammatory response in the lungs. Again, symptoms, cough, shortness of breath, chest pain. You can sometimes cough up a little blood with it. There is no good treatment for lipoid pneumonia. It's what we call supportive. So if you get it, I just keep you alive until your body can take over. And it's true. It really is true. It's called supportive care. So the single most important thing you can do is to identify what's causing it, in this case vaping, and eliminate it. This is a picture of lipoid pneumonia. This is a patient we saw, a 46-year-old male who was healthy, came in with shortness of breath, again, flu-like symptoms, weakness, fatigue, chills, that means sweating, diaphoresis, fever, cough, and he reported a 4 to 6 month history of daily vape pen usage, some with flavors, some without. And so we diagnosed him with lipoid pneumonia. And you can see, remember, good lung is black. There's all kinds of white on this lung. And so he had lipoid pneumonia. This is a picture of what's called a photomicrograph. Basically, we did a biopsy on this patient. And these red spots over here, those are actual fat globules that the lung took up from the patient smoking the vapes. And so that's how that was diagnosed. No treatment. This is the treatment. This is a ventilator. This is a patient on a ventilator, not mine. This is just randomly off the internet. Basically what happens is this is the breathing machine. This is the patient. We have a tube in the nose. We have a tube in here that goes down to the lungs. We push air into the lungs and we support the patient until their lungs can recover, and it can take days, sometimes weeks. And so that's what a patient looks like when they're on the ventilator. This is a fun one. Spontaneous pneumothorax means a collapsed lung. So a spontaneous pneumothorax or collapsed lung occurs when there's a hole in the lung that basically pops. It can be an injury, gunshot, knife wound, or just blisters in the lung, and that's kind of what we're talking about. Those who develop blisters are usually young, tall, thin people, usually males actually, and it happens during adolescence. These blisters don't normally produce symptoms. You don't know you have them, and but if they pop, they'll cause some pain. Smoking and now vaping are associated with increased risk of these blebs bursting. Ever seen a garden hose with like the vinyl or cut and it blebs out, that's what happens, okay? Signs of a collapsed lung are sharp chest pain or shoulder pain, shortness of breath. This is a patient we saw. It's an 18-year-old male high school senior with a history of asthma who presented to the emergency department complaining of a week of shoulder pain. It became worse, his breathing became worse, and that prompted him to seek care. As we questioned him more, we found out that he was a frequent vapor, and we did this x-ray. Anyone want to guess what's wrong on this x-ray? I know you're not medical professionals. I showed this to my family last night. Mrs. Fiedler here is in the audience today. They all got it totally wrong. They guessed on the wrong lung. Anyone want to guess? Okay, those arrows are the lung, okay? So this lung is normal. These are lung markings, the lung's fully inflated. This is the lung deflated. So you can see, although my family thought it looked cool to have a nice uniform lung here with no like lines through it, that's definitely abnormal on a chest x-ray. So this patient requires a chest tube. Basically, step one, so this is the chest wall, here's the lung, and it's collapsed. We numb the skin up, we put a scalpel in there, we take a scissors thing and open it up, air rushes out, you put your finger in there, move the lung out of the way, you put the tube in there, you slide the tube up, and voila, we have fixed the patient's lung. After 3 days in the hospital attached to the wall suction, the lung sealed and the tube was removed. This is the tube that's in the lung, and you can see the lung has markings through the whole thing. Okay, lastly, can vaping cause lung cancer? More of an issue for adults, I think, but I get asked this all the time. I have patients that smoke, obviously. I have patients that can't quit, obviously. And they ask me, should I vape instead of smoking? So this is a concern. Again, we don't know, but you know, it can't seem good to put the stuff, tobacco puts fine particles in the lung, this puts fine particles in the lung. The bottom line is vaping hasn't been around long enough, okay? We might find new diseases in 40 years for people who vape every day, and we just don't know the answer to that. Despite that, most experts, myself included, do not recommend starting, okay? I have patients ask me, do you mind if I vape if it will cause me to quit? And I'm very honest, I'll be like, my answer is, I wouldn't say I don't mind, but I know smoking is bad. And so I guess if vaping makes you not smoke, do it, but I certainly don't I don't recommend it. But I'm just like, I don't know. You know, I don't know what's going to happen if you vape, but I know smoking's bad. So, none of us experts know what to say. So, but I'm not going to go ahead and give you permission to vape if you want it. So, in conclusion, vaping is a significant public health problem with increased use among teens. Marketing is a factor. Health concerns range from acute damage to the lungs to chronic problems. And whether vaping contributes to lung cancer remains unknown. Thanks for having me.
So I'm Sadie Jensen. I work for the health department, and I do tobacco prevention all the time. I will also tell you I am a former smoker. So I have a lot of experience in terms of what it means to quit, what it means to try to quit, how hard it is, what the addiction cycle looks like. I have experience doing all of the things, the gum, the lozenges, the patches, the medications, the counseling, all of the things. So if you have any questions, please ask as we go through. So here's a little bit of what we are going to talk about today. What we want to know is, I'm going to show you a little bit of what these vape products look like so that you can better identify them. We'll look at some signs of vaping use. There's a bit of a caveat in there, just as with the doc. A lot of the things look similar to other things. So just because you see a sign of vaping does not mean the kid is vaping, okay? So just they're caveats, but there's certainly things to look for. Reasons why youth vape, we'll talk a little bit about that. Talking to youth about vaping, and I have some tips and resources on there. I will also give you another kind of tip right now. I have a QR code at the end of this presentation. So this link to this entire presentation, all of the links in the presentation, if you scan the QR code at the end, you will have access to it. So you don't have to worry about trying to really fast write down links. So let's talk about identifying some vape products. How many vape products do you see in this picture? All right, let's check it out. There's 5. Any of those surprise you? Right? This one, that one got me too, and I work in this every day. It looks exactly like a real pen. It even writes like a real pen. If anyone's seen Juul devices, I know the doc showed one, they look very similar to this, and they look very much like these USB drives, these flash drives as well.
Which one's this?
These two? They are called Sauron. They're drop ones. So the top part comes off and you can replace it. It's a refillable pod one. So as you can see, they're a little sneaky sometimes to try to find these. They're very small and discreet sometimes. Doc showed Elf Bar, which is one of the very popular brands. They typically look a little bit like this. These are some other popular styles as well. If you see things like that, they look kind of like markers, like pens, USB drives, that kind of thing. These mod devices are not typical and super popular anymore, but they are still used. There's certainly kind of a certain group that really likes that type of device. And they come with these refillable e-juices. There's just kind of a subset of people that vape that in particular like those. They're called mod devices because you can make adjustments to them. You can take them apart. You can get different bases for them. You can get different tops for them. You can get different mouthpieces. They're a little bit more of a hands-on device than some of these ones that are disposable. So let's look at some signs of vaping use. Again, the caveat, just because they have some of these signs does not mean that they are vaping, but it is something that you can look for. Frequent restroom breaks, closed doors, and being secretive. Who knows a teenager that fits that description? Okay. This one does kind of get me a little bit. The odd smells, the fruit, candy, room fresheners, that kind of thing. I also used to work at detention and helped out doing laundry. There was no lovely smells coming out of that. And so if you have teenagers, if you smell like the fruit, the candy smells, that kind of thing, something to be aware of. Sudden changes in behavior or mood, anxiety, irritability, mood swings, anger, and outbursts. We hear a lot about this where there's maybe some withdrawal going on, and so the irritability gets really heightened, and that sudden outburst with a youth is very prevalent. Disappearing money, changes in spending habits, and increased online purchasing. We just recently watched a webinar where they were talking about being able to purchase through apps like Venmo, Cash App, and even on Instagram. And I don't know if any of you have gotten sucked in by the TikTok shop, but I certainly have. And so I know that they can certainly purchase those on there. If they're drinking more water, in vape devices, there's a thing called propylene glycol, and it's what causes irritation in the lungs and in the airways. And so that also creates kind of the feeling of being thirsty. And so drinking more water to try to replace some of that. Increased nosebleeds, again, that kind of soft tissue irritation that comes from the vape. Raspy cough, mouth sores, and that's from the ingredients in the vape kind of sitting in the mouth. Lung infections, chest pain, shortness of breath, pneumonia. So again, very similar kind of symptoms that happen with any type of maybe upper respiratory infection and things like that. So just something to be aware of. This was a new one for me that I learned about recently, caffeine sensitivity and having kind of a jittery feeling. And that comes from the nicotine salts, which is what is used in vape devices. And it's just because they are so kind of stimulated by the nicotine, it makes adding caffeine onto that just increase that jitteriness, the anxiety, and that kind of thing. Changes in sleep. Who here knows a teenager that has really great sleep hygiene? Nobody. Okay. So it is part of the developmental process for teens to have some issues with sleep. But again, something especially in combination to keep in mind. We've also heard things about youth keeping their vape under their pillow at night. because they're so addicted that in the middle of the night, it will hit them and wake them up. And so then they are using their vape. And as we previously discussed, because of the lithium battery and the potential for those to explode or cause a fire, not a good idea. Changes in appetite, nausea, GI distress, and weight loss. Dr. Fiedler talked about this a little bit as well, the NICSIC. So when you smoke a cigarette, right, you have this long to smoke, and then you're done. When you have a vape device, how long until you're done? Till the juice runs out. How many puffs are in those? 5,000, 7,000? How many puffs are generally in a cigarette? Anyone know?
50, maybe 60?
Way less, like 20? Yeah. And so when you have a vape device that doesn't turn off, right, there is no off, and you're just continuing to use it and use it and use it and use it and use it, that instance of getting like nicotine overdose is essentially what happens, nicotine poisoning. And so you get that nausea because you've had too much nicotine, and it can create weight loss if you do that too often because you're nauseous all the time. And nicotine is also an appetite suppressant, and so that will affect your appetite. If you see a lot of charging cables, unfamiliar pens like we just saw in the previous one, USB drives, other devices, pods, materials that look weird to you, ask about them because they could be something that you need to know about. Other signs of use, they have materials that youth can buy, like sweatshirts where they have kind of hidden pockets in them, or backpacks that have hidden pockets. They do make devices that look very similar to other devices. So this is an e-cigarette watch, and this is a smartwatch. They look almost identical. They have a little Game Boy system here, and this one is an e-cigarette. So they do look very similar. On the top here, looking at some different lingo and language that kids use with some of this, like stealth mode, ghost, Puff Bar is a brand, a very popular brand. Rip, hit, nick, that kind of stuff. There's a whole list if you click on that link and it tells you what they all mean. Usually by the time you figure out what something means, they've changed it. So if you hear lingo or you hear some type of words getting tossed around by a youth, just ask, what does that mean? So you can kind of get a little bit more insight into what that means. And withdrawal symptoms, we'll talk a little bit about that in the following slides, but you can also start looking for some of those as well. Does anyone have any questions so far? Yeah. Yeah, so we'll talk about that a little bit with the withdrawal symptoms. So it can, at least temporarily, make them not feel so good, right? Because if you're using the vape, and Dr. Fiedler talked about that, it increases all of those feel-good chemicals that are going on in your brain, right? So if you don't get those feel-good chemicals in your brain because you're stopping, then your brain says, we need those, and then it gets very irritated. And it takes a little while for your brain to get back to normal. And so sometimes that can feel like I'm depressed, I'm anxious, I feel stressed out, but it's only for a short period of time. If it happens to be to continue after that, I would say talk to a pediatrician, talk to a mental health provider to see if maybe that's something that you need to get some extra help with. So reasons why youth vape. What do we think? They make it look cool, right? And easy to use. Has anyone in here watched the documentary Big Vape? Eunice has because I made her. I had to have someone to talk about it with. I had feelings. So if you have a chance to check it out, it's on Netflix, and it's about kind of the rise of Juul, which was the beginnings of youth vaping kind of in the United States and it becoming very popular. They specifically talk about these devices being created to eliminate the difficult things about smoking, right? So the stinky smell, the fact that they're not super discreet, right? That you can't like smoke a cigarette and nobody knows about it. That they are designed with these nicotine salts to be effective and to get that nicotine into your system as easily as possible and as least harsh as possible. Because if you have something that's harsh and really difficult to use, do youth want to use that? No. And so that ends up, in turn, being really attractive to youth that want to use those. So from the National Youth Tobacco Survey, this is back from 2021. We couldn't find the answers for this on 2023, so I'm not sure if they asked this in the survey on that year. But in 2021, 58% use them because a friend uses them. 48% because of curiosity. Is curiosity a bad thing? No, it's not. And it's also part of that developmental stage, right? Becoming, to be a teenager means to try to find your own identity outside of your parents. And so being curious and trying different things is actually a positive developmental step. Go ahead.
Sorry to be a snob, but that adds up to more than 100%.
It does.
What's that?
That is good math.
Oh.
You are absolutely correct. And here's why. Because they could pick more than one answer. Yeah. That was a really good catch. But this is their reasons for ever trying. So they might have picked more than one answer. So curiosity is another one. Feeling anxious, stressed, or depressed. We'll talk a little bit more about how using nicotine actually doesn't help that system. And then getting a high or getting buzzed. This is reasons why they currently use e-cigarettes. What changed there? Feeling anxious, stressed, or depressed.
What's tricks?
Tricks. So that goes back to some of that lingo, like the ghosts and things like that. Being able to like blow big clouds or to make rings out of that. So it was, especially in 2021 and with social media, there was a lot of kind of tricks that people were teaching other people through these videos. And again, it goes back to that making it look cool. So yeah. But interesting how it changed from ever used, because maybe they saw another friend using it, and maybe a little bit because I'm not feeling so great mental health wise, to I keep using it because I feel anxious, stressed, or depressed. Because what we know about that, and we'll get into this a little bit more, is that cycle of addiction that we have already started talking about. That feeling of stress, anxiety, depression, that kicks in when you start craving nicotine, right? So starting to feel that anxiety, that stress, is really your body saying, I need more nicotine. So how do you fix that? Use more vape. Use more nicotine. Exactly. That's the solution. But then you start the process all over again. So then it just keeps going round and round. So talking to youth about vaping. Here's what we know doesn't work. Okay? This is for all behavior modification, actually. Shame, anger, fear, disgust. Is there anything else you guys want to add to that list? If somebody makes you feel shame about something, is it something that you really want to change? Or do you just want to not hang out with them when you're going to do that, so that they don't judge you?
I heard somebody say control.
Control. Okay. Because who has 100% control over another person? Nobody.
Bargaining and lack of finances don't seem to have any sort of influence either.
Nope. Nope, they don't really help. There's also a reason why I have now started my presentations with, hey, I'm a former smoker, because it starts to eliminate some of that shame and stuff that goes along with people that are trying to quit and that kind of thing. It opens the conversation up so much more because there is such a stigma. I have people that come up to me at outreach events and they're like, I used to be a smoker. I'm like, yay, good for you for quitting. That's awesome. I used to be a smoker too. How'd you quit? Because it changes the whole narrative. Even hiding the fact that you quit tobacco goes along with that. There's a lot of shame, and it keeps people in the cycle of addiction. So here's what we know does work. Okay, I know what that says. I wrote it there, okay? So, underreacting doesn't mean don't react. It doesn't mean don't have consequences. It means don't overreact, right? We don't need people flying off the handle, screaming, yelling, arguing, because what does that do?
It just escalates the whole thing, and yeah, just people withdraw from that.
Yeah, it completely shuts down communication. And we really quickly get into that. Really quickly. And it's tough to like stay calm in that moment. And so being prepared for it is something that's really helpful. So we want to underreact. We know that this is a possibility, that this is something that could happen with our kids. So we want to be prepared and stay calm if those things happen, because we want to have that open communication. We don't want to shut it down. We don't want to be judgmental. We don't want to be sarcastic. That one's my biggest hurdle. It's to like, in my brain it sounds one way, in my mouth it has to come out another way. So keeping those lines of communication open is what continues the conversation, right? Ask questions. Be curious, genuinely curious. Hey, I went to this thing about vaping today, and I heard about how it can hurt your lungs. Have you experienced any vaping at school? What does that look like at your school? And then listen. You don't have to talk the whole time, right? It's about listening to what they're experiencing. Compassion. How many people in here have had to battle with an addiction or with changing a behavior that was really hard? Okay. How many of you did that as an adult? Okay. How easy was it for you? Not. It's not easy to change behavior. And youth in particular, brains are still developing, bodies are still developing. They're in this stage of life where they're trying to figure out who they are. And so marketed products to them that tell them this will make you feel better, all of your friends are doing it, look, we have cool fun flavors, you'll have so much fun doing this. And then they use it and we expect them to what? Just hand it over, we're done. We're done with that. No, that's not how it works. And so we have to have those conversations many times with compassion to say, hey, this is something that you could experience in your life. Let's talk about it. Let's talk about what that could mean for you. And then scripting and practice, right? Practice makes progress.
Well, you can see what I still struggle with.
I know, right? My head immediately goes to perfect. So I recently watched a webinar, and I have it linked on the slide underneath in the ones that you have. But it was from a parenting expert that I just watched from PAVE, Parents Against Vaping E-Cigarettes. If you, I'll get into the resources here in a minute. But she was spectacular and came up with a couple of different techniques that you could use in having these conversations with youth. I statements. Who knows what an I statement is? Yeah? Okay, what's the structure? I feel blank when you blank because blank, right? So I feel concerned when you vape because I know that you like to participate in athletics, and I know that your school has consequences if they catch you vaping. And then it opens the conversation to them. So what does that mean? What does that mean for you and for vaping? Let's talk about it. The sandwich technique, anyone heard of this one? No? No? So it's positive, critique, positive. I want to squish it together, right? So you want to say, hey, I know that you are a really good friend. I also know it can be really hard to tell a friend no if they're offering you something like a vape. It's really hard to tell them no. But I know that you are really smart, and I trust you to make your own decisions. But I also want you to know that I support you. So come talk to me about it. So it's just making that sandwich. I know that it can be really hard because that temptation is out there. I know your friends are going to ask you. But I'm here to support you. So come talk to me about it. Positive. Critique. Positive. So let's talk a little bit about addiction, and you can talk with youth about this as well, because sometimes they don't know what that looks like, right? I want to do it because I want to do it. I'm not addicted. I can stop anytime I want. My favorite saying when I was a smoker was, I quit all the time, in between every cigarette. So it is what it is, and especially when you're a youth, you're invincible, right? That's not going to be me, but we know that it's an astronomical, it's like 98% of people that start smoking before the age of 21 or using nicotine products before the age of 21 will continue. So what does that look like? So there is this vaping reality check quiz. You can give it to them, and they can take it on their own. I'm not saying you're addicted. There's this quiz out there, though, that will tell you if maybe that's something you're dealing with. And these are some of the questions that are on there. You ever tried quitting vaping and you couldn't? Do you ever feel like you lost control over it? Or do you feel anxious or irritable when you want to use your vape but you can't? So just some of those kind of questions to get them thinking about what that looks like. So we've talked a little bit about the cycle of addiction. So it starts with nicotine use. You get that craving satisfied, all the happy chemicals in the brain, and then those start to dissipate. It takes about 20 minutes. And then within a couple of hours, you're going through withdrawal. And so then we're increasing stress, increasing anxiety, increasing feelings of depression. And the solution then would be increased nicotine use. And that cycle gets faster and faster as it progresses. So these are some symptoms of withdrawal, and you can talk about this with youth, and this is also something that you can watch for if you think that there's potentially vaping happening. So some of the mental and psychological symptoms, again, those mood swings, cravings, feeling anxious, having trouble thinking clearly. We hear this a lot, in particular because the youth brain is still developing, and in particular those areas with memory, with attention. So that brain fog definitely happens. Some of the physical symptoms, again, that coughing, sweating, feeling restless, jittery, stomach aches, and actually you will have increase of appetite as well if you're going through withdrawal because you don't have the nicotine suppressing that or the nausea that comes with it. So this is what the timeline looks like. Who here wants behavior to get fixed now? Right? So much easier if I can just take the vape away and we're all fine. It takes weeks. But the good part about this is you can have that conversation and you know what's coming. So it doesn't feel weird, like I'm the only one that's going through this, that I'm the only one that has withdrawal. If I just smoked, it would be fine. If I just used vape, it would be fine. And then you got to do this all over again. It does take weeks. And there's different stages of how this goes along. Usually after about 3 days, the nicotine in your system is gone, and so that physical kind of symptoms are going away within that week period, that first week period. But you're going to have some persistent stuff going on for at least a few weeks. It is normal to have that. It takes a little while. So here's my fun resources and support for parents. And again, all of these links are to, if you scan the QR code at the end, these will all go to where they're supposed to, hopefully. The FDA has a tobacco education resource library. It's full of tips, videos, articles. They literally have conversation this is how you start the conversation. If they say, hey, you smoke, how come I can't? They have all those kinds of tips. Same with Campaign for Tobacco-Free Kids, and another excellent resource. Parents Against Vaping E-Cigs has webinars all the time. These are actual parents of youth that vape, and have a ton of resources. They do advocacy. They pull up research and medical documents as well, and have a ton of recordings as well. They also have a very active Facebook group, and so you can chat online with other parents. And then Truth Initiative has a parent text line. That number is on there. Out on the table we have these little cards as well, and they have the parent text line on those. This is just a free text line. It's through Truth Initiative that you can text QUIT to, and it will send you tips, advice, just random text messages to keep you motivated about talking to youth. For youth, you can always call the Nebraska Tobacco Quit line. They just this year, recently, added a text line for youth 18 and under, so they can text Start My Quit. Yeah, it's huge, it's massive. So they can text Start My Quit. We also have locally in Lancaster County, we partnered with Truth Initiative to do Ghost Vape, which is our own text keyword to 88709. Nationally, you can text Ditch Vape to 88709. It does the same thing. It takes you to the program This Is Quitting with Truth Initiative. So we have these cards out there as well. If you go to any LPS middle or high school, Norris, Waverly, SEC, Pius, or Lincoln Lutheran, you will see in the bathrooms they have mirror clings of different designs.
They do, I've been.
Yeah, this is a fun sneak peek for you because these aren't up yet. Some of them are used. But we try to have fun messages on there that engage youth and provide an educational fact or information, as well as access to Ghost Vape. So they can scan the QR code, or it gives them the access on there as well. Teen.smokefree.gov is another access point for quitting. They have online quit planning. They also have live chat. They also have an app. They also have a text quit line. So, and Not For Me is a self-guided, mobile-friendly version of a Not on Tobacco curriculum for youth. They can do it all on their own. Educators. We have Aspire, which is a free online prevention education resource that you can sign up for, and youth can take that. Truth Initiative's Vaping Know the Truth is another curriculum for 8th through 12th grade. That's also completely free. The Tobacco Prevention Toolkit from Stanford Medicine is probably one of the most robust prevention toolkits I've ever seen. So they have a ton of different resources in there. They have a couple different curriculums, including a vape-free curriculum, and then they have a smokeless tobacco and hookah curriculum. They have fact sheets, they have posters, they have connections to Canva, and so that you can put your own stuff in there. They also have a alternative to suspension program called My Healthy Future. And you can have it run also by a facilitator, as in like a teacher, and that one's called Our Healthy Futures, and that is all free.
Does that have to be run by a facilitator, or can they do it
They can do it on their own.
on online?
Yep. And then another alternative to suspension program would be the in-depth program by the American Lung Association. That one is more of an in-person, and you have to have a trained facilitator. Some other resources, Not on Tobacco is another training where they have to have a facilitator that's trained in doing that. Catch My Breath is another one that we often report and use. I added this one on here very last minute because everyone always wants to ask me, so this youth is vaping, or I know where they got their vape, what do I do? Like, this store is selling it, whatever, what do I do? So the FDA has you can report an alleged violation to them, and they will investigate that. So there's a link there that you can fill that out. It's online. You can do it via phone or you can do it via mail if you want to. And these other ones along here are just different organizations on the bottom where you can find further educational materials, information, that kind of thing, updates on laws, and that kind of thing. And then Tobacco Free Lancaster County is our local coalition if you're interested in joining. Tobacco Free Nebraska is our funder and provide us with a ton of information and resources as well. If you don't live in Lancaster County, we have places all over the state. Ta-da. Maybe not quite as fun, but yeah. Yeah, so that is the QR code if you want this presentation. All of the links should work. And it also has my contact information on there if you have any questions after the fact. Yeah. So what questions do we have?
Secondhand exposure. What can you tell me about that?
Yeah, so what we're learning is the secondhand exposure to, we call it secondhand aerosol, is very similar to secondhand smoke, right? In Nebraska, we have the Nebraska Clean Indoor Air Act that not only includes you can't smoke, all of the places that you can't smoke, workplaces, public places, you also can't vape in those places. So what we know is those fine particles and all of that stuff that we talked about going into the lungs also goes into the air. Things that go up have to go, yeah. And so then they land on everything. So we talk about this a lot too with folks that have little kids, that it goes into soft surfaces and then littles are on the floor, right? Or they have, blankets and clothing and that kind of stuff, and then they're putting their hands in their mouth, and it's very easy to transfer that. We talk a lot about too with nicotine poisoning, making sure that those things, if you do vape as a parent and you have littles or you have pets, to make sure that you're keeping that out of arm's reach. But yes, we do know that secondhand aerosol is a thing, and it does impact others that you're around, not just what's going inside of your lungs. So typically what we see, like, who's heard of third hand smoke? Not my tobacco people. All my tobacco people. Who here has walked into a place where somebody has smoked and you smell what that smells like, right? And you see it on the walls, you move the picture and you can see the outline of where the picture was. Okay, so that's third hand smoke. That residue that is on there, it's the same thing also with that, with vape. It's just you maybe can't see it as well. What we do see, and what I have heard from folks that vape, especially in their car, they have to wash the inside of their window because it gets oily. And they can't see because it gets all smudgy and oily. And then it's really hard to get off. And it's the same thing in apartments or homes where people have smoked and they have to get all that residue off. You have to come in with a special cleaner and get all of that off. It's the same with vape. We just can't see it as well. What other questions do we have? Yeah.
What's the current status of LPS school policies, and do they have any special equipment to monitor air quality?
I'm not sure about air quality. That's a good question, but they have put into some schools the vape detection devices in the bathrooms to help them with enforcement and evaluating who's using in the bathroom so that they can do some intervention. I do know that they use Vape Educate in the schools for youth that get caught vaping. But in terms of air quality and that kind of thing, I don't know.
I think you answered my question with the sensors that you mentioned.
Yeah.
Do you know which schools, or are there just some private schools?
I think they just started it.
At just one high school.
Yeah.
And then there has it.
Yeah, it's east.
School that it was
It's
private.
expensive. I know Plattsmouth
Yeah.
School has it, I believe Waverly has it, or has looked at installing it in some of the others, but it's pricey.
Yeah.
And it requires staff to be able to go into those bathrooms from those
Yep.
schools now.
Yeah.
So, but
Yeah.
I think at least it's reduced bathroom use. For one, that makes it feel a little better for the kids that aren't vaping to not have
Right.
kids moving around.
Yeah.
Private school.
And that's actually not the first time that I've heard that kids literally, they won't drink water all day because then they won't have to go to the bathroom because they know that the bathrooms that they're by, people are vaping in there and they don't want to go in there. So the poor kid doesn't drink water all day. That's true. I hear Stanley Cups are out now. That's the new thing. Yeah.
Yeah, I think they're looking at some of those, but yeah, cost is a factor. And
Cost is a huge factor, yeah. Yep. Yeah.
So with tobacco policy, when I left the business, we were looking at on a federal level, changing or having some parameters for the amount of nicotine in cigarettes. Has there been any more talk of that related to vaping products?
Not in the United States that I'm aware of. In the UK, as Dr. Fiedler talked about, in the UK there are restrictions on vape devices. I believe they set it at 20, and here there is no, or 2% salt nic. And here the average one, we just got done doing counter tools, which is we go out to all of the tobacco retailers and just evaluate what products they have, and the pricing and the advertising and that kind of stuff. We should have some data on that later this year. But it was 5% salt nic in literally every device that we saw. And in the UK, yeah, they set it at, I think, 2%. So not something that we've really talked about here. I know that there is some pending legislation on some of those things in local jurisdictions, but nothing on the federal level. They're still working on the menthol ban on the federal level. And vape devices now have to go through pre-market review with the FDA to be evaluated on whether or not they can advertise. I know that there was a question earlier about nicotine devices when they first came out being advertised as a cessation device. There is no approved cessation device that is a vape by the FDA in the United States. So none of them are. They're going through pre-market review because they can't make claims like that. They can't make health claims. They can't make that they can cure things claims. So while they're in the process of pending review, they are allowed to be sold. So once they get their pre-market approval or denial, then they have to get pulled.
you mentioned some apps where kids can purchase.
Mm-hmm.
Do they have any system to check?
Yeah, so in the process of doing this presentation and some other presentations, they'll have on the website, you go to the website and it'll say, are you 21? And you click yes or no.
Yeah, I found that we purchase.
And there's some mail carriers that won't.
No.
They're not going to deliver. They don't want to deal with that either. And so they won't even deliver. They won't carry those. So, yeah, it is getting a little bit better in terms of that. But social media, when they open new things online, like the TikTok shop and that you can buy things on Instagram, it's so many different places where you can purchase things from that having those regulations in all of the places is really difficult.
It's whack-a-mole.
It is a little bit of whack-a-mole, yeah. Yep.
I know tobacco companies have to pay. But
Yeah, so there's the Master Settlement Agreement, which happened in 1998, which they're paying for all of the damage that they have done. There's recently the Juul Settlement Fund as well, which Nebraska was awarded this last year. And so in total, over the span of several years, we get like $10 million for tobacco prevention efforts and education around vaping. And like LPS schools had their own lawsuit against Juul with that as well. So they have their own separate fund for that. So there's several states, different jurisdictions, schools, and that kind of thing that are getting money from Juul specifically on that. Other brands, not so much.
Because they should
It's a long game.
they should all be providing the pricey bathroom
Yeah.
sensors.
For sure, yeah.
I feel like banging.
Yeah. It is a little difficult. We are making progress. As you saw with the 2023 Youth Tobacco Survey, in high schools at least, it's decreasing. And I would say, just because it's maybe my job, that has to do with our prevention and education efforts. we hear very kind of polarized when we go out to events and outreach activities. Youth are one way or the other. It's either I vape and then they want to talk about that, or vaping is gross, I don't want to do that, that's disgusting, like that kind of thing. And so we get one or the other. So I think that that's changed a little bit. It is concerning about the middle school one, I'm not really sure. And actually this year we will have local data for Lancaster County because it goes based off of the behavior risk survey, and that's being done currently in several LPS schools and other schools throughout Lancaster County. So we should have some local data. The last data that we have, the reason why we use national data in this presentation, the last data that we had locally is from 2019.
Yeah, I just wanted to mention that this is actually a 3-part series that we have done, and so we do have a final event on February 29th. Sadie will be here for that as well, but we are partnering with behavioral health for that one to really dive into some of the mental health, psychological impact that we're seeing with our kids who are vaping, especially if they need other types of support, such as behavioral health intervention, substance use treatment, that sort of a thing. And so that will be February 29th here as well. And we have a provider from Genda who will be speaking on that topic. And so that mental health piece, especially because we do see a lot of self-medicating going on with our youth as well, nicotine, marijuana. So she's going to tie in both THC vaping as well as the nicotine piece that we'll see as well. So that should be another informative event. So mark your calendars. Yes, yep. We'll be doing some more promotion of that as well. So thank you. If no other questions, thank you for being here and giving of your time and listening, and hopefully you all walk away with some new information and have a great evening. Thank you.